Hi, it's me, Ingrid, the INFP, and I'm talking about psychiatry today. I've done 2 months of my rotation in psychiatry, and it's good. Um, if you've seen my last video, I was basically having a breakdown because I was in internal medicine, and basically I was running on steam, like I wasn't doing well. So I basically am in rehab now in psychiatry because it's so much better hours and work environment, basically. I've both been like doing having open care and then hospital care. So I've been at the departments, the wards, and the emergency, and the just checkup visits. So I like doing the regular visits because, well, it's less intense. It's interesting. You get to meet people, talk about their lives, and you get to like take care of their medicines and stuff. And I've had pretty good conversations. And in the emergencies, sometimes really crazy stuff happens, but it's not like life or death like the other emergencies are. Well, of course, like people can commit suicide, but it usually doesn't happen like super acute. Like I have to act now within these next few minutes, or otherwise something will go wrong. Somebody might get aggressive, but usually there's time for me to call the senior doctor and ask them what to do. The psychiatrists have been really, really good, and they encourage us to call for like anything. Like we have to call pretty much for all the patients that we meet, and that's something that's like unheard of in the internal medicine. they don't, they're not the same. The psychiatrists really are helpful, and they make the decisions there. It's not like I make any decisions on my own. I make the decisions at the visits, like that are not acute. But if I'm at the emergencies, they make all the decisions. Sometimes it can be a little bit scary at the emergencies because people are unpredictable. Sometimes people come with the police, but usually when they come with the police, I can always ask someone senior to be with me when I talk to the patient. So that's good. I mean, a lot of people might see INFPs as like the ideal psychiatrist if there's a specialty that an INFP would choose. I'm not sure. I mean, I do really like talking to people, but it is draining in a sense that people are often angry with you at psychiatry, obviously, and that might be something that's hard to handle. Also, the fact that you get to decide on another person's life, like deciding if they have to be stuck in a hospital or not, might be difficult for an INFP to handle. Even though we love helping people, the way you're helping people often at the psychiatry is pretty authoritative, and it's so it might fit some INFPs. It doesn't really fit my idea of what it is to be a doctor. I also find, I mean, this is also weird to say, but INFPs, we do value TE, like logic. Well, TI could also be logic, but TE, like, no nonsense structure stuff. I mean, we have TE at the bottom of our stack, so like we need that. And a lot of stuff in psychiatry like doesn't make any logical sense. It's a lot. I mean, the medication. Sure, there are some studies, but like, for example, lithium. Nobody really knows why it works in the way it works. There are theories, but I think INFPs they need we need some kind of structure. Otherwise, we wouldn't be able to dream the way we do. So I think that maybe like INFPs can be pretty good with data. We do have that SIT. Like we maybe don't love it, but in a certain way we need it in order to feel like what we're doing makes sense. So I think it might be a little bit too fluffy in certain aspects, the psychiatry field, because it's not studied enough, basically. But of course, it does allow us to use our creativity, which is something that you don't often use in medicine. But our conversations with patients, there's like an art to it, and I think we can be pretty good at that. We're really good with empathy, and I mean, sometimes the patients will say, "Oh, well, you don't understand," but sometimes they think they realize that we do connect with them on a level, and I think that we have a great strength in that. Another thing is a lot of us have mental issues, so we actually really do understand when patients come to us with their problems because, well, we've experienced it ourselves, or we know somebody else who's experienced it. And I think we're less judgmental than other types, like what is normal behavior. I think that we're good at like saying that it's okay to not be normal. I've had discussions with parents to people with like kids or like young adults with ADHD or other problems, anxiety, and like the parents like don't understand at all their kid, and they expect me to be on their side rather than on their kid's side, and they get a little bit of a shock when I tell them that like it's okay for their kid to be that way. So it makes me hurt for these poor kids, but like I think that if there's anybody who will understand someone with mental illness, well, it's the INFP. Of course, there are other types that can do it too, but I think INFPs understand it. I mean, we are good at understanding people. One thing that I think INFPs may lack is the NI, NI-FE combo would probably be best for like a psychologist, because we don't pick up on cues and like know how that person is feeling enough to be able to document it then in the journal and then to like explain what we saw in a person. Because INFPs, we're not like really good, we're like in our own bubble. So we're not super good at actually feeling what the other person is feeling and like seeing the cues and understanding what they're feeling. We just understand from their discussion which feelings are coming out. But we're not actually, I think that an INFJ, ENFJ would be really good at diving deep into the feeling of a person and seeing what lies beneath the surface. Like they're really into this psychoanalysis. Well, I think that for the INFP, it's more about the story. Like we can connect to the story rather than the actual person. So, like it works. It's just it's a different way of functioning than what is actually required of a psychologist or psychiatrist. But it works really well. So I think that I have a calming presence in a way for a lot of patients, and maybe I should be a little bit more forceful even with psychiatry patients, but we're all different. And there was a psychiatrist at the hospital that we were in like the ward number 1, which is basically where the most aggressive patients come. So they're like really manic or psychotic, and that's not a good place for the INFP, basically, because that's not a place where you can have like discussions. But he said that it was really important that we have different kinds of doctors, because he was telling, for example, I think that he's an FE type. He gives too much room for the patients, like he wants to keep the patients in the hospital, and so he doesn't, and he wants to understand them. While there's another doctor at the hospital who I think is a high TE user, and she basically like wants to send people out of the hospital so that they can deal with their problems on their own, so that we don't like baby them into being in the hospital. And she's really good in terms of making like decisions and being firm with patients. So both of these doctors are really great, and both are needed. And I think that that's an important message, that any type can be a doctor. And like, I was just happy to hear that from somebody who seemed like a good doctor. Yeah, I think that concludes my segment on psychiatry. I'm sorry for the last video where I was like down in the dumps, but I think it's important to show when things are not going great. I mean, now things are going fine. I think it's important to show my experience. And I mean, if you don't like it, go to another channel. Bye.